Oh, how is everybody for a Friday of week 3? Hard to believe
I'm good.
3 weeks have gone by. So by this point, let's see, just want to make sure I have everybody on camera. Um, by this point, everybody should be pretty organized, right? Pretty organized with your calendars and all your due dates for all your classes, when quizzes are, when exams are, right? And you probably should be well into quizzes and exams, or at least exams coming up in classes, right? So I think what we'll do for today, since I have the quizzes timed to start at the beginning of class, we'll just start off with the quiz. Everybody should be able to pull up quiz 2 at this point. Don't start it yet. I just want to give you the structure of the class. So we'll do the quiz. And then before I go over the quiz, I want to go through some housekeeping items, some announcements I sent, groups, all of that, um, and go over any information or as far as exam reviews, what the update is with those, and then a little bit on the exam next week. Okay, so we'll do that, and then we'll finish. Who's in the waiting room? Pardon the interruption. Not sure. Let's see who's coming in. Is there somebody? I don't see anybody in the waiting room. Okay. And then we'll review the quiz, and I've been able to do a lot of my content teaching through the quiz, and then we'll see what we didn't cover with my notes, and then we're going to do a case study. We're going to do a migrant case study. And I think this class is just too big to break up into groups into the breakout rooms. And so we will just do we'll do the case study together. I'll just put it on the screen and we'll do it together. How's that? Just too big to break up in breakout rooms. So does that sound like a plan for today? It goes quick. Today, this week goes quick. Um, so everybody needs to be on camera for the quiz. You can go ahead and everybody needs to be on mute as well. So if everybody could check their mute button, and then I'll mute myself. We'll do 15 minutes. It's time for 15 minutes. I have a couple of students with accommodations, so they get a little bit extra time. And so it is 4:04. So for most of you, the quiz will go to 4:25. And then for the few that have accommodations, they'll get till like 4:30. So go ahead and do the quiz. Please take your time. I know there's a code. I'll give you that in a second, an access code. Take your time. If you're done early, don't jump off camera. Okay, stay logged on because it's got all this log on, log off gets all tracked in the attendance. If you need to turn your camera off after you finish, that's fine. But we'll be starting right up at 4:30. So don't rush through the quiz to get a few extra minutes off. Okay, take your time with the quiz. All right. So the access code is again my last name, capital MAR, V as in Victor, EL. And so go ahead and get started. And please stay on camera during the quiz. Okay.
The password?
I just told you the password. My last name, capital MAR, V as in Victor, EL. I'll put it in the chat. How's that? Let me put it in the chat. Okay, there you go. It's in the chat. Could everybody please mute? Please, everybody. Please mute. Christina, we're taking the quiz.
Can you hear me, Kathleen?
Robert, we're taking the quiz. I'm going to put you on mute. Everybody's taking the quiz, okay? The code is in the
Okay.
chat. The code is in the chat. I need to mute you.
All right, okay.
Okay. Cecily, can you hear me?
Yes, I can hear you.
I've sent you a message in the chat. You're not on camera.
I don't know. Hold on.
Yeah, you're not on
'Cause I'm-
camera. You need to be on
Hold
camera
on.
to take the quiz.
Because I'm on my.
I can't hear you. You're on mute.
Am I on now? You can see me?
Yes, I can see you now. Okay.
Okay.
Thank you. I'm
Now
going to
I'm
put you
on my
back.
phone. It keeps going in and
That's
out.
okay. That's okay. I'm going to put you back in the main room.
Okay.
Thanks. Okay, is everybody done? There were a couple of people that still weren't done. Are we all done? Cecily, just stay on after and we'll talk about what we're talking about in the chat, okay? Please. Okay. Okay, everybody back. Let's see, I still have several people that are either not back or coming on camera. I need Samantha. Yeah, I need all you guys to come back on camera. Cecily, did you get my message? Just stay on after. Okay, fantastic. Rebecca, Quintia, if you guys could come back on camera. So how'd you do?
Okay.
Not very well, but that was very distracting with everybody just like talking and chiming in.
Who was talking? I thought we were all muted.
No, there was several
There was
people.
a lot of talking.
Yeah.
Like at the beginning when people are coming in, it's really like this. I'm not trying to be like mean. It's hard like to concentrate. We only have a little bit of time, you know?
Yeah, no, I thought I had everybody muted at the beginning. I know there was a couple of, okay. Okay, well, I guess I'll just remind everybody like I did at the beginning that you need to mute yourself, right?
Yeah.
I didn't hear. Maybe you guys didn't hear. You heard what I
I
didn't.
heard it,
I
and
didn't-
it definitely was described.
Pardon me?
Well, it was that like people talking and then
Yeah.
it was the recording stopped and then the recording started again. Like all those little things are like when you're on a timed test, they're all very distracting.
Yeah, no, I haven't touched any of the recording. We are still recording. I didn't log off or log on the recording, so, and I didn't hear any talking, so I'll have to go back and take a look at the first 15 minutes of this recording and see what you guys were hearing that I was not. So I thought I did a spot check and everybody was on mute, so
The recording did stop on my end because it said recording stopped. And then I looked over to make sure I was still on camera.
okay.
And then a couple, like maybe a minute and a half, 2 minutes later, I said recording starting or recording again. So the
Alright.
recording stopped in the middle of my quiz.
It happened to
Okay.
me too. I heard it as well.
Okay, all right. I'll have a look at it. Okay, so did everybody do their readings and prepare for the quizzes? Because that's where I pull a lot of the quiz questions from is the reading.
Yeah,
Yeah.
that was
Yeah.
helpful.
Yeah, I did do the reading. I did still find, however, that the quiz was kind of difficult.
Okay,
I agree with that. I don't
Oh.
think the reading helped me much either.
okay.
I
Well,
I agree. The
did
reading was
better.
great,
I think
but
it was
it
the
was
wording
kind
for
of
one of
hard to
them.
focus on one thing.
Okay. All right, well, let's go through some housekeeping items and then we'll go and review the quiz and figure out where you had some incorrect answers. Okay, so let's talk about the test next week. So at this time next week, you'll be taking exam 1, right? It's taken in class, right? I haven't had any, well, I just had a recent one, but I haven't had any requests for anybody to take the class on campus. So, if you, let's see, actually, Cecily, we might be okay because the exam's not till next Friday. I was thinking it was Monday. So if you plan to take the exam on campus, you have next week by probably Tuesday, Monday or Tuesday, you got to let me know who your proctor is going to be. Okay, and then provide me their information so I can reach out to the proctor and the dean and make sure everything's set up. And then, yeah, you can certainly take your exam on campus if you're more comfortable taking it on campus. Okay, so that's one option. Otherwise, everybody's expected to be here. I'll have a second instructor here with me proctoring the exam since there's so many students. I'll send out a announcement this weekend with just some exam prep information about setup and how I check in and when it will be available for download. The exam won't be available for download until an hour before class. And that will be part of the big announcement, kind of prep announcement for exam 1 I will send out over the weekend. Okay. Next week is week 4, so we'll cover, and it's an exam week, so we'll cover weeks 4 and 5 during week 5. Okay. What else about the exam reviews? So I've sent you one review earlier, a couple days ago. I sent you Professor Ford's review from this past Monday. She didn't have any students there, so that was kind of disappointing, but you have the recording. I know a lot of people have clinicals, class, other commitments. I get all that. Okay, but we do have a recording from that. I'm doing my review after this class this evening. So, and then Professor Kershaw is going to be doing her Sunday night, and you have the master schedule, right? I think mine tonight is at 6 p.m. Eastern. So after this class, Professor Kershaw's is Sunday night at 6 p.m. Eastern. Okay, and then you'll have the recordings for both of those as well. So you've still got 2 more live reviews to go to if you can, and then you'll have 3 recordings. Okay. If next week you find that you have done your due diligence in preparing for the exam, and we're getting close to Friday and there's still some concepts that you don't understand and you would like to reach out and we can go through them, I'm more than happy to do that. Okay. But I want to make sure you've done your prep work, listened to the recordings, did all your studying, and then we'll review whatever you're still struggling with. So you got to reach out to me next week. Okay. Announcements this past week. I did send out groups. I did have several emails about people asking to switch groups, that their whole group wasn't their whole campus. So here's the issue with this class. It's 2 sections. Okay, so I have to treat each section separately. So I have to formulate my groups based on the section that you're in. Okay, so you may end up with some students from your campus and other students not from your campus. Okay.
I have a question about that.
So go ahead, Holly.
I've emailed the 2 other people in my group. Ryan is in my group, and I discussed partially with him about the topic paper, but I haven't received emails back from the other 2 people in my group, and I'm not quite sure what that entails, but I have so many papers that are getting ready to come up, and I don't like procrastinating and waiting. So how do I get involved with these people to say, okay, well, what portion of this, are we doing? How do we want to formulate this? How do you want to work this? Because I can't, my schedule is so tight and compact that I can't sit around and wait and say, okay, well, it's 2 days before this paper is due, and now
I get it.
Well, Holly, I'm part of your group and I haven't received an email from you.
I sent one.
So I can tell you that.
Campus.
I say I can try and send an email out as well. I don't know if it's, you maybe had the wrong email or something, but I haven't gotten anything.
I sent it through the Canvas, the link on Canvas, through
Okay,
everybody's email. So I did send the emails to everybody except for Ryan because he's in my group. So everybody else he's on campus with me. That's why I didn't send him an email personally.
So a couple of things about that. So this is I get, sometimes there's a sometimes there's a downside. Can we do the one-offs at the end of the class, please? We have under an hour. I'm sorry, I don't know what that means.
That means that she wants me to hold my questions until after class.
Okay. All right. So there's a downside in doing groups early. Doing groups early, if you send out your email, say in week 2, and you want people to respond right away, it's not due till week 7. Okay, so So part of your initial conversation in the group needs to communicate. Everybody needs to get together and say, we're either going to do it really early or we're going to do it closer to when it's due. So not everybody has the same schedule and the same needs. So I'm not hugely concerned right now that your groups haven't responded, because again, we're only in week 3. It's not due for a month. And so that's one of the downsides of sending groups out early. I used to send them out in like week 5. Right? So you know, I would say that if you are the coordinator of your group, and this isn't just to you, Holly, this is just in general. If you are the coordinator of your group and you're sending out an email, then I would give them, since it's not due till week 7, a couple of weeks to respond. You know, not everybody may not have the same sense of urgency that you do. So that would be my suggestion. If I would say you get to the end of week 4, week 5, and there's people you haven't heard from, I would say to let me know, and I will reach out to those students that are not responding and see if I can light a fire and get them going. Okay.
Yes, ma'am. Thank you.
Does that help? Okay. All right. I think that was it as far as the groups. What else? Is there anything else we need to address before we get to the quiz? Okay. All right. Let me share my screen.
Professor,
Yes.
so just a question about so for other online classes, they've been doing reviews that are guided by like review PowerPoints. For this class, I guess basically what we have is as like a guide is the concept review for exam 1, correct?
Correct.
So it's kind of just, it's not even like specifically what you want us to study within that concept. You're just like kind of highlighting the concepts that we need to go over.
Right. And I'm
Okay.
hoping that you're taking notes during class when we're covering those concepts. And that's the information. You're building your study guide from lectures and from your reading. And then when I go through my reviews, when we go through our live reviews, we cover a little bit more specific information.
Okay.
Does that help?
Okay. Yeah. So would you say that your weekly PowerPoints are a more specific like study outline and a way
Yeah,
to guide? And
sure.
Okay.
Yes.
All right.
Yes.
Thank you.
You're welcome. Okay. Let's see. Okay, can everybody see my screen?
Yes.
Thank you. Okay, question number 1. Okay, what should the home health nurse anticipate about a clients in very rural communities? So from your readings, what did you learn about rural communities?
They will be more likely for the chronic illness.
Okay.
Less
Right.
access to healthcare
Yep.
places.
Okay. What else? There's a lot of information about the rural population.
They're more likely to have environmental chemical exposures.
Absolutely. And what's the most common kind of environmental exposure for the rural population?
The pesticide.
Pesticides.
Chemicals.
Yep. Chemicals.
And I think like the big thing is the is the distance, just like where they're located. You know, not only like their proximity to like, you know, health, like good healthcare based on where they live, but also their ability to get to it if it's in, you know, like 30, 45 minutes, an hour away.
Exactly. One of the big barriers is transportation, right?
Yeah.
Big barriers, transportation. Another big barrier is access to specialists. And like I said, I'm going to do a lot of teaching from these quizzes. So this first question talks about the overall observations of the rural population. You know, I reside in a rural community. The public health nurse up where I am in Northwest Wisconsin covers 4 counties. Okay. As far as doctors up here, there's a family physician. That's it. No pediatricians, no OBGYNs. You have to travel. As part of what Ryan's saying is there's not access to all this specialty care. So if you're diagnosed with, let's say, cancer, or you're diagnosed with, you need surgery, you're going to be traveling to different parts, to bigger cities, right? To seek out your care. A lot of people, how do rural populations view their health? Do they view it as important?
Not really. They see their job more important.
Their job's much more important. A lot of in the rural population, a lot of jobs are hourly based, daily based. That's how they get paid. People in the rural populations don't have, most of them don't have employer related health insurance, right? Or dental insurance, or vision insurance, or retirement benefits, or paid days off. They just don't have that. Okay. People that live in rural populations typically don't prioritize their health, right? They certainly don't prioritize their preventative health, right? Primary care visits, even into secondary for screening. They just don't see if they're feeling okay, they're okay. They don't feel the need to go in for primary care, even screening. So what happens? By the time you see them in urgent care or an emergency room, what happens? What do you observe?
Professor.
They already have chronic.
Yeah, they're already in an advanced stage of whatever's going on. Yes, Ryan.
Could you say, like, is it a fair assumption to say even like the quality of healthcare? And the reason I say that is, where I live, about 10 minutes from where I live, there's the city of Scranton, which is probably one of the bigger cities in the area. And then there's a kind of a rural area that also has, like, it has a hospital, and there's hospitals in the city of Scranton. And a lot of times, if they're more severe cases, they'll take them to like the hospital in Scranton versus the rural hospital.
Sure.
So
Well, there's just not a lot of specialty care. It's basic care. So yes, quality is an issue. Access is an issue. You're traveling to the bigger cities if you need more specialized care. Right?
Ryan, you could take an example, like I work at CMC in the trauma center, so they're not going to take a gunshot wound to Regional Hospital of Scranton. They're going to take it to CMC.
Right.
Absolutely.
Just kind of think of it in that sense.
So let's go to question 1. Which should the home health nurse anticipate about clients in a very rural community? What's the right answer?
A, they will be more likely to have complex chronic illness.
Right, because they're not focused on their primary care. They don't see their health as a priority. B is just the opposite. Most of them will not have employer paid insurance. C, they will be much more likely to have environmental chemical exposures. And then, as we just talked about, access. Most of them will not have access to physicians. Does that make sense? So I'm trying to be a little bit more detailed with each question, so I can try and explain about the questions that you got wrong. Okay, number 2. The nurse is developing a primary prevention program for members of the rural community. Which intervention is appropriate? So let's review our primary, secondary, tertiary. What's primary?
Prevent.
Prevention. What's secondary?
Screening.
Manage.
Screening? Nope,
Screening.
no, screening. We're screening for risk.
Mhm.
right? And what's
Yes.
what's tertiary?
Treatment.
Treatment.
Treatment, management. They have to have something. That's the key for tertiary. They have to have something. So what's the right answer for B?
B.
Oh, excuse me.
B.
What's the right answer for 2?
B.
B. B. We're trying to be, we know that weather exposures can be extreme in the rural communities, right? People working outside in the sun, in the cold, in the hot, in the heat. Right? So we're trying to provide information on minimizing excessive sun exposure. What is A? Primary, secondary, or tertiary?
That's secondary.
Secondary, screening. What is C?
Tertiary. Tertiary.
Why is it tertiary?
Because they got diabetes already.
Exactly. They have diabetes already. And then what is D?
Secondary.
Secondary. Does anybody have any questions about that?
I do.
Yep.
No.
I know that D is secondary, but for some reason, I don't know if it was this class or a second one, it was saying like to try to catch something before it happens. So that would be secondary rather than am I confusing something?
Secondary is identifying risk.
Okay.
So when you say you're trying to identify something, are you trying to identify somebody that might be at risk of something? Taylor?
Yeah, I guess I was thinking, I think it was last week, I'm not sure, all the classes blend together. Something to do with like children out of school who are obese, like if they were obese, then would be secondary or would be trying to manage that. But the first one was like checking out all their diets. I don't know why I confused myself. I know the answer is B, but I think I thought a little, do you know what I'm saying?
Yeah, you
Or
thought
no?
too much into that. I mean, D, it's screening, the words right in the answer.
Okay. So B is just the preventative is just going to be education, no screening at all, or screening of all people, or no?
Nope, screening is
Okay,
all
I don't know why.
secondary.
Okay.
But
Thank you.
remember, Taylor brings up a good point. Don't, and I said this last week, don't just think that education is in the primary level, right? In the primary, we're educating to prevent. In secondary, we've identified them as being at risk for something.
Okay.
And so we're educating them on how to reverse that course. So if we find they're at risk for obesity, we want to teach them how to not become obese. Okay?
Okay.
Tertiary, we're educating on how to manage it, how to treat it. So education is at every level. Does that help, Taylor?
Yeah, I just thought too much about it.
Don't think
Thank
too
you.
much about it. Remember, I like to do a whole bunch of exam taking strategies during these quizzes as well. Remember, if the information is not in the question, it does not exist. So Taylor, I'm going to use as an example. Taylor overthinking and maybe putting more information into the question that's there is going to cause her a problem. It's going to cause anybody a problem. If you are an overthinker and you're adding information into the question that's not there, it doesn't exist. The only information you need to pick the right answer is in the question. That's it. You're not being, these are straightforward questions. You're not being asked to add, well, what if this, what if that? No, that's the overthinking. Okay. Okay, number 3. Migrant farm worker presents to the outreach clinic complaining of bilateral eye irritation, throat irritation, and a cough. So, as you read about the migrant farm workers, what are these some symptoms about?
Would that be
Chemical
about the,
exposure.
Pesticide exposure.
That's letter B.
Kristen, is that what you're going to say?
I think so.
Yeah. So let's break down this question. During an exam question or a quiz question, I don't know, and I can't see everybody, so I don't know if you use the highlighter. Okay? There's a couple of tools in ExamSoft that I would highly suggest using. Okay, and I'm going to stop here and give my tips on test taking strategies with this question. Okay? There's a highlighter tool and there's an underline tool. The highlighter tool is for you to highlight words, phrases, cues in a question that are important. Okay? There's an underline tool to cross out answers that you know are not correct. Okay? So let's take this, let's use that. I'm assuming that everybody reads a question more than once. That's my assumption. You should be. Okay? So on your first go at this question, what's all the important information in this question that you could highlight on the first go around? Who's the
migrant
Farm worker.
Who's the
Migrant farm
population? The migrant farm worker.
Yeah.
Okay. What are the symptoms? Your eye irritation, your throat irritation, your cough. Okay. So you're going to highlight what's important in this question. And then my suggestion would be that before you even go and look at the answers, my suggestion would be that you come up with an answer in your head. Okay. Don't even look at the answers. Okay. And then go ahead and look at the answers. If what's in your head is one of the answers, it's most likely right. Okay. So let's assume that you're going to go look at the answers. You don't have, you haven't formulated an answer in your head and you're going to go look at the answers. This is, remember, your first go around. As you go through each answer, there's probably at least one, if not two answers that can be underlined or scratched out, right? Okay. So now you've set up the question. You've highlighted important words, phrases, cues. You have scratched out an answer or two. So now you're going to go back and read that question a second time. And all those highlighted words are going to pop out, and you might be only looking at two answers to choose from. So that's one of my test taking strategy tips for a question like this. Okay, so what is the right answer for this question?
B.
Okay,
B.
we know we're working with migrant farm workers, and we know they have multiple symptoms here: eye irritation, throat irritation, cough. That's potentially a problem with pesticide exposure, right? Conjunctivitis, maybe the bilateral eye irritation, but as far as throat and cough, nothing to do with it. We are not going to request a physician's order for an antihistamine because we're not even sure what's going on. Plus, we wouldn't do that. Okay, we're not at a point where we need to complete a tuberculosis symptom screening questionnaire. These are specific to pesticide exposure. Why is additionally C wrong? What about our scope of care? What do we not do?
We don't diagnose.
Correct. We don't diagnose and we don't treat. That's important to remember in our scope of care. You know, when I was working in the schools, yeah, I was pretty darn sure the kid had conjunctivitis, but when I called the parent, I would say, you know, they've got some eye irritation, they've got some drainage coming out of their eye. You know, I would suggest you come and pick them up and take them to the doctor and figure out what's going on. If the parent said, does it look like conjunctivitis? Yeah, it looks like it, but I'm not diagnosing it. Okay.
Professor,
Yes, Ryan.
my only question with that is, in leadership, we're learning about SBAR, and part of the SBAR reporting when you're working with the doctor is like making a recommendation.
For what?
Like when you're
So
calling
let's go back to the previous question. Okay, so what would you making a recommendation about here? What would you do?
Okay, let me I mean, the recommendation would be some type of either a test to confirm that they, or I mean, I don't know, some way to validate or confirm that they definitely have the like the pesticide poisoning, or
Well,
some way
it
to some way to
isn't
rule out.
isn't that what B is asking? We're asking them if they apply chemical pesticides at work. Think of your nursing process. You have to do an assessment first.
Yeah, it's
before you-
assessing.
No,
Yeah,
I know what you're saying.
before
That's
you
why
can make
I thought we were on oh, you were asking me why the third answer choice isn't it isn't possible.
right. Well,
It
how
might-
do you know what they have? See, we're overthinking this question. We're way
Right.
overthinking this question.
No, I know, and that's why I was just more or less saying that the third answer choice, I guess I know it's not right because of the context of the question, but I thought you had said like that's not something we would do within our scope of practice. And my only question was because the way we're learning about the SBAR is that there is situations in which like you make a recommendation to the doctor.
After you've had a diagnosis,
Okay, all right.
right? We don't know what's going on here. So to
Okay.
just request a antihistamine based on the symptoms, we're making assumptions. We're
Okay.
diagnosing, and we
All
don't
right.
do that.
Okay.
Does that
Thank
help?
you. Yep, it does.
Okay, question 4. So during a home visit, the nurse notes that the migrant farm worker's family is living in a small house with several other families, which nursing assessment is a priority. So what are you going to highlight in this question that are important words, cues, phrases?
Migrant farm worker in a small house.
Okay.
Priority.
And priority.
And priority. So having read about migrant farm workers living in small houses, small quarters, what are some risks?
Just TB from the reading. That's the only reason why I know that. I would never knew.
Okay. All right. Well, now you know, right, Taylor? And you got the question right? Good. Right. So you have to think about who's the population, the migrant farm worker. Oh, they're living in small, close quarter houses. Risks, TB, GI issues, hepatitis. It comes with a specific list of risks. So
I believe that the Cecily was trying to say something too. I interrupted her. I'm sorry. I don't know if she had anything to add.
no, go ahead. So the only answer really here is D, right? There's nothing about a GI issue, nothing about hepatitis, nothing about other risk factors with this particular population living in close housing. So if you had gone into this question and scratched out answers, you literally could have scratched out A, B, and C. Does that make sense?
Yeah.
Okay, question 5. So this is a poverty question. Which statement reflects the impact of income on health outcomes? Without even looking at the answers, just think about that question in general. Not for just community class, just in general. You're out there working in the community as the community nurse, and you know that individuals, families, communities living in poverty come with certain risks, correct?
Chronic illness.
Okay, chronic illness.
Yeah.
Okay. Oh, so you're saying, Christian, you're saying the answer C, right?
I believe so.
Low income increases the risk of chronic illness.
Yes.
Yeah, based on what I was reading, that's what I
Yes.
was getting from it.
Yes.
That's correct. Right? If you are living in poverty, you are going to be at increased risk for chronic illnesses for a lot of reasons we've already discussed.
If
Right?
you don't,
Lack
you're
of
unable to pay
access.
your medication.
Yeah. Lack of access. You're living
Yeah,
in
lack of
poverty, may not be
access.
able to afford your medications.
Yeah.
Lack of quality health care. Lack of getting kids to primary care visits for vaccinations. Right? A, low income guarantees access to Medicaid. It doesn't.
No.
It doesn't. High income reduces the attendance to wellness visits, just the opposite. Okay, it increases the attendance at wellness visits. And then high income does not improve health outcomes. It does. It does. Access, private pay, access to specialty services that people living in poverty may not have. So there's a lot of answers here that you could have crossed out on your first go around. Okay, so which should the nurse anticipate for families living just above the federally defined poverty line? What would you highlight in this question?
Above the poverty line,
Mm-hmm.
would that be improved health outcomes then?
It's A.
It's A.
Ah,
Because
It's
they
just
are,
above, yeah.
but it's
But I
above.
picked the wrong one too.
It's above.
it's
Okay,
above the poverty line?
so it's above, right? So because it's above, they're gonna be, they may have access to less community resources.
Oh, okay, so,
Increased they may be more vulnerable due to fewer community resources because they are above. Even though, you know, the word, it says just above, but they're above. I mean, simply, you don't qualify, you don't qualify.
Yeah, you can make like $10 more and then you don't get
Exactly.
Medicaid anymore.
Exactly.
And then unless like you're super, like unless you're rich or like super poor, but that's not good either, then you don't get any, like, you know, like,
See,
a lot
that
of people
one is-
fall in that.
that one is tricky though, because just in the previous one too, this kind of like, I'm thinking of it like that because it's like with a better job or whatever, you got access to better like healthcare.
Yeah.
That's
So like
true.
I guess I'm thinking like a personal standpoint, like, you know, like my kids, like because I'm in school, like we have Medicaid, but like just because I get a better job doesn't mean I'm gonna make a lot more money. I might make like $200 more a month where I don't qualify for Medicaid,
Mhm.
but I'm not good. That's not enough to get like good health insurance a month. It's like a
Exactly.
weird like in between.
Exactly. Exactly. But if you are living above the poverty line, whether it's $10 or whatever, $10,000, you will have you will not be eligible for certain resources.
Okay,
Right?
I guess I'll think of it like that now, because that one was kind of like it can. Okay.
Well, again, if you are taking out really if you are highlighting out important words in this question, you're living above the poverty line. So if you're above the poverty line, you're going to have less access to resources. As far as B, improved health comes compared to those in poverty, no. No.
Maybe if it was like really above the poverty line where you do have access, I think that's maybe the confusion. Like, you know what I mean? If you have access to private health care and stuff. I got it right, but I'm just saying, you know.
I guess maybe let me ask a question for you. If I redid this quiz question and took out the word just,
it would change my answer.
Would that throw you off? Would that?
Yeah.
Okay.
Because if you're like that, the just thing makes a difference to me. Like you said, you're just there. So maybe it could even be it's time for requalification and you got a higher paycheck that one time and now you don't qualify. So that for me, yeah, but it's a personal thing rather than, you know.
Yeah. But again, you got to be looking at the questions real carefully. Okay. Reduce vulnerability due to employer provided insurance. No. Unchanged health comes. No. Unchanged health comes compared to other incomes. Love, there are changed health incomes depending on your income level. Okay, question 7. Okay, so which client is at the highest risk for adverse health outcomes related to poverty? What do you want to pull out of this question? What are you going to be looking at? It's a
Highest
priority
risk.
question.
Age.
Risk.
It's the age.
No,
Yeah, and the age. Maybe
And
the
the-
elderly are the highest risk.
okay, let me take a step back. What is what in the question are you going to focus on? What's important in the question?
Okay,
Poverty.
health.
Adverse
Health.
effects.
The highest risk.
First health.
Highest risk. Highest. Okay, so when you then look at all these answers, okay, this is a good example of you look at all these answers and you think, oh, there's more than one answer that could be right. Well, if it's not a select all that apply question, you have to go back and reread the question to see what you missed. And in this case, you might have missed highest risk. Highest. It's not to say that every one of these clients is not at risk, but the question is asking who's at highest risk. Okay. And we know it is a fact that children are at the highest risk of adverse health outcomes related to poverty. Children. Okay. Elderly is not very far behind them. But let's look at our two high-risk populations in these questions. Okay. 15-month-old without a medical history. That's a problem. Right?
Yeah.
We don't know about immunizations. We don't know about medical history. Whether it's due to access or they're not going in for care or not going in for checkups. Versus a 68-year-old female with type 2 diabetes. Yeah, they're at risk, but not
They
as
already
risk
know
as
what
the
they
50.
have.
Yeah, not at risk, and you know what they have. Exactly. But with a 15-month-old, you know nothing with this 15-month-old. So you have to prioritize. This is what's called a priority question. I'm sure you've heard about that in your other classes.
Yes.
Okay. Question 8. What should the school nurse expect for an impoverished adolescent? What did you learn about poverty at the adolescent level?
That they need to work instead of
What's
go
the
to
biggest
school.
risk? What's the biggest risk for adolescents?
Dropping out.
Drop to school.
Dropping out of school. That was in your reading. Okay, that's the biggest risk. Okay, and if you look at the other answers, they're exactly the opposite. You're going to have an increased risk of unintended pregnancy. Do you think an impoverished adolescent is going to have great coping skills?
No. No.
Probably not. And do you think an impoverished adolescent, a struggling adolescent, is going to have improved attendance at extracurricular activities?
No.
No, they're probably not even going to want
They
to
need to hold their
participate.
parents.
Yeah.
That's what they said.
The biggest risk is them dropping out of school. Okay, number 9. Which client is the highest risk of homelessness? What's important in this question?
Highest
Who
risk.
thinks?
The highest risk.
Highest risk, and who's your
And
population?
Homelessness.
Homelessness. Okay. So again, another example. This is not a select all that apply question. You might look and say, oh, well, all these people look to be at high risk for homelessness. Well, I must have missed something in the question going back. Okay, now who's the highest risk? So who is the highest risk?
veteran.
The
The
veteran who's got
Why?
PTSD and he lives
Because they're
alone.
living
Home
alone.
alone.
Lives alone. Because look at
Yeah.
all the other answers. You have an
They
adolescent.
have support with everybody else, really.
Exactly. Exactly. And that veteran is at the highest risk. Number 1, PTSD, and number 2, living alone. It's not that the other 3 are not at risk. They are. Right? But the veteran is at the highest risk based on these descriptions. And the last question. The nurse is working in an outreach clinic at a homeless shelter. Which client should be prioritized? There's a lot of information in this question.
Yeah.
Okay,
that
she's
one-
working at a homeless shelter, and we need to figure out who needs to be taken care of first. So if we know that we're working at a homeless shelter, then who is our population?
Homeless.
Homeless. They're in a shelter. It's a crowded area. Okay, what are the risks?
Infection, sickness, like
HIV.
Okay. So one of the biggest risks is a TB outbreak. And so what are the symptoms of that? That's A, right? It's not that B, C, and D will not need to be cared for and seen. Okay? You have to prioritize. It is a client that potentially needs to be screened for TB, because the last thing we want in this clinic is a TB outbreak. Right? So B will get seen. C has to be assessed for what's going on, and D has to be assessed for what's going on. But we really have to get a handle on patient A. Does that make sense?
Yes.
Okay. So now, having gone through it like we just did, do you have a better understanding of the questions you got wrong?
I'm sorry, can we go back to number 10 for 1 second?
Go ahead. I'm listening.
So the answer is A then?
Uh-huh. Those are symptoms of, go ahead.
Go ahead. Of
No, go
TB.
ahead.
Okay. Because my thought was like, my initial thought was just like the highest risk for infection, and like
it doesn't, but Ryan, it doesn't say infection. Okay.
Well, the foot ulcer with or purulent drainage and the redness is
are symptoms of infection, right?
Oh.
But the question is simply asking who should be prioritized, and A is a potential risk of a client that potentially has TB, and we know that because of the setting and the population, that's high risk.
Okay.
Okay, it's not that B is not important. I mean, that's right behind A. But if that's a sign of an individual with an infection, that's a lot less of a priority than somebody that potentially needs to be screened for TB.
And TB is contagious, very contagious.
Right.
Exactly.
And I think for me, it's important that I focus on like the context of what we're studying and what the question is asking.
Bingo.
And
bingo. That's exactly right. That's why I said that's why I asked you, who's the population? What's the environment? And what do we know about that population and that environment?
And no overthinking.
So Ryan, so it's not to say infection isn't important. Of course it is.
Right.
But a contagious potential outbreak of TB needs to be screened.
Okay. Thank
you. Having gone through the questions, does that help with having an understanding of what you got wrong?
Sometimes it's better for me to hear it too, because it's like the way certain things are read, or like how certain teachers put emphasis on stuff or whatever. It's like, oh, okay, like you can have I don't know, for me, that's what works better too. But I am getting better at process of elimination too, and making, like you said, sometimes the questions I have, the answer in it a little bit, like the signs and symptoms or the main people or population that they're talking about. So it kind of helps that way too.
Right. Exactly. And I don't know if it helps you guys about trying to highlight and just trying to find my week 3 PowerPoint. It helps to eliminate answers. All right. Remember your quizzes, your exams, your HESI. I was just talking with a student earlier today. The expectation is taking your knowledge and applying it. That's why so many of these questions are clinically focused. the client in the homeless shelter, the migrant clinic, right? It's intended for you to know the population, know about the population, know what the risks are, so that when you see these clients in your practice or in your wherever you're working, it's clinically based questions. Does that make sense? It's not definitions anymore like it used to be. What is a migrant what's a definition of? The expectation is you have the knowledge, now you have to apply it. So here's our PowerPoint from this week. Let's see what we didn't cover. Here's your migrant farm workers, right? The other thing about migrant farm, now that I'm just going through some content that we haven't covered yet. They're part of the risk with migrant farm workers is they're seasonal. They're always moving around. A lot of them are agricultural workers. So let's say they go to a clinic and they are diagnosed with hypertension, they're prescribed medication, whatever. They don't have health insurance. They'll be at a migrant outreach clinic, but the likely of their health chart being portable and going with them to other places is very unlikely. So they're almost starting over. Does that make sense? Because they're so mobile. So that's another big issue. Common health concerns specific to the migrant farm worker. One of the things I would like you to know is the difference between acute and chronic pesticide exposure. You're going to get asked about this. You're going to be given a scenario in the exam. Is it acute? Is it chronic? So remember, acute is acute exposure, like right now, like today, right? And that was in a quiz question, but additional symptoms, memory loss, difficulty concentrating, mood changes, abdominal pain, maybe some nausea, vomiting, diarrhea. Okay, so acute GI. Okay, maybe headache, confusion. Chronic means you have been exposed to pesticides for a while, 6 months, a year, 10 years, 20 years. So you have to think chronic. So think things like cancer, maybe for women, reproductive issues. Okay, blood disorders, neuro problems, reproductive issues. That's more longer term. So acute is all the GI headaches, maybe a cough, but long term, you've got to be able to tell the difference between long term and short term exposure. Okay. Barriers. We did touch on barriers. Language, literacy, language barrier, and literacy is a big one with migrants. A lot of them don't speak the language. So a lot of them also defer going to a doctor, right? How am I going to communicate what's wrong with me? How am I going to understand what they tell me what's wrong with me? And how am I going to understand what the treatment plan is? Right? So language is a big barrier. Transportation's a big barrier. Hourly work, daily work is a big barrier because maybe they can't afford to take their kid who's been coughing for a month down to the cities or to the next largest place to get their kid looked at by a pediatrician. Because guess what? They don't get paid for that day. Right? The other thing about migrant workers is they're eligible for some benefits, but they're not eligible for a lot of benefits. Like they're not eligible for WIC or SNAP. If they get to go to a migrant outreach clinic, they may get temporary health insurance for the time that they're at their place of work, but they're not eligible for government resources. Okay. Rural populations, common characteristics. What do we know about rural populations? They're small. They're very tight-knit community. I'm just trying to add things I haven't said already. They're small community. They like to handle things themselves. They're very tight-knit, right? Churches, religious places of worship, are their social support system. They don't like newcomers, right? They like everything. You know, the community I live in up here in Northwest Wisconsin, Everybody knows everybody. Everybody knows everybody's business, right? Newcomers are like, okay, just, come up for the weekend and go back to the cities, right? They're very, very tight-knit community. They want to handle things on their own. They all sit around the kitchen table all the time talking about everything, right? Within their community. Just a very tight-knit group. Okay. Again, low, poor health literacy affects this population just like the migrant population. Rural population typically has more chronic illnesses. We talked about substance abuse issues, alcoholism, drug abuse, overdoses. Like it's up here, I take a 10, 12-mile ride to the nearest city, and I swear there's 4 or 5 billboards that talk about fentanyl. Drugs are a big issue in rural communities. Okay, domestic violence, violence in general, much higher in the rural communities. Okay, many more fractured families. Okay. Types of healthcare services difficult to access. Well, anything specialty. They are really, and I talked to this public health nurse a couple of weeks ago, I've become friendly with because she knows I teach this class from a rural community, and she's been wonderful. She said they're really increasing the broadband, laying the lines for internet in a lot of rural communities so that they can start telehealth or improve telehealth, right? A lot of hospice nurses, home health nurses don't want to make a drive from the cities to do one patient visit. Okay, so specialty care is hard to access in the rural areas. We talked about that. Homelessness, right? Care the homelessness initial approach. This initial approach is trying to establish a trusting relationship, therapeutic communication. And most people don't want to be homeless. They do have a story to share. Whether they're an individual on the street, it's a mom on the street with her kids. Okay, they have to be able to trust you. Okay, I don't know if you've ever worked with the homeless, but once you establish that initial relationship, initial trust, they can open up to you, they will. And then you really can do an assessment of what they need. Whether what the kids need, if the kids are homeless, individuals, elderly. But the initial approach is critical. Who's affected? Who can be homeless? Anybody, right?
Yeah.
Any age group, any ethnic group, any religious group, any career, doctors, nurses. It's not anybody. Anybody can end up homeless for any reason. Okay, some common clinical medical conditions for the homeless: cardiovascular disease, dual diagnosis. Dual diagnosis would be like mental health and substance abuse. It'd be like cardiac issues and substance abuse, right? Or cardiac issues and smoking. Injuries and violence, common among homeless. Preventative health issues, big. I mean, this population doesn't seek out preventative care, right? Where do we see these? Where do we see this population seeking out their care?
When they're already sick.
Yeah, they're already sick, but where do they go?
Emergency room.
Emergency rooms. And what's the most expensive place to get care?
Emergency room.
Emergency rooms.
But it's free for now. I think that's probably why, right?
Somebody's got to pay for it, though. It's free for them.
Understand, but if they go to urgent care, usually you won't be paid. You can't be seen unless you pay. So I think that's why they go there.
Yeah. But a lot of them, their only option is to go to the emergency room, which is an incredibly big cost of care on the community. Right? Skin and foot problems from exposure to heat, cold, not having shoes. All right, so skin problems are a big issue. Resources. In your reading for homelessness, there is a table of national resources for the homeless if you would like to look at it. I don't know if anybody works with the homeless, or if you go into community nursing, if you'll be working with the homeless. Poverty. Okay, we talked a little bit about the definition of poverty. There's a line. You're either below it or above it. And the government every year reestablishes what that poverty line is. Okay, in your readings, in your Canvas reading about poverty, there's some incredibly informative graphs in there about geographic locations of poverty. There's also in your rural population page, there's also some graphs that show the lack of healthcare specialists in rural areas. So have a look at that. You hopefully you already have if you did your reading. What are the effects of poverty on young kids, on adolescents, on teens? After COVID in the schools, a lot of families went from being not in poverty to in poverty, living in poverty, whether they had to sell their house, move out, live with a relative, parents lost their jobs, had to stay home with kids, right? Kids were very much affected from the social isolation of online learning. It was much different at the preschool level, elementary, middle, high school. Okay. And then think of homeless families that live in poverty, or homeless families that are obviously living in poverty. What are the effects of the younger kids versus the older kids? How do they look at it? What are their effects? Right. So what can we do for caring for this population? Be compassionate, be empathetic, be non-judgmental. As a community nurse, you have to be very resourceful on what is available in your communities for individuals, families, communities that live in poverty. What kind of resources do you have for them? What kind of resources do the schools have? Okay. Talked about that. Homeless, poverty in your reference page. Let's take a peek real quick. I'm just going to pull this up. Let's take a peek at I'm just going to pull up. I'm going to send you this. When I send you the recording for this class, I'm going to send you this case study. Okay. I sent you the student version of the case study, which doesn't have the answer. This is where I want to put you in breakout rooms. But I'm going to send you my version, because it has the answer and the rationale. And I want you to take a look at this just to support your learning for migrant and rural health. So have a look at this right here. And let's do this 3 questions real quick and tell me what you think the answers are. So Janelle Garcia is a nurse who works in the public health department. She's assigned to a rural health clinic. Large Hispanic population, many migrant farm workers, primarily male. Okay. This town is 45 miles away from the nearest city. Okay, it's located within a farm. Many of the large farms have housing quarters known to be occupied by undocumented workers. Farms are situated within a field of grapevines and peach orchards. Sounds pretty. As a public health nurse working in the rural practice, what are some of the professional challenges? So think of yourself out there all by yourself in the rural area working as the nurse. What do you think?
I would say the lack of resources.
Yeah, that's it. Lack of resources with other professionals. Remember, if you're a nurse working out in a rural community, you're on your own. The closest you may have to a second opinion is calling somebody 45 miles away. So the question is, what are some professional challenges? Not client challenges, professional. So what are some challenges for her?
Maybe a language barrier.
Yeah, well, that's it. The lack of resources with other health professionals is her challenge. Okay. So the answer is C. So some of the challenges of rural practice, if you are working in the rural community, limited opportunities with continuing education, communication with peers, lack of working with other people. You're by yourself, right? And everybody knows you. So there's some lack of anonymity, restricted social life. Many nurses value the close relationships with the clients and the coworkers, along with all the clinical experience. Because remember, if you're in the rural community, you may be working with babies, kids, teens, adults, elderly. Okay. So she's working primarily with Mexican immigrants. Okay. What cultural health beliefs and practices is she expected with the Mexican population? Okay, so here you have to have an understanding of the culture of the Mexican population. Okay, so Mexican population clients may appear to be nodding, right? But do they really understand? Okay, so this is a common practice. Okay, and I'm going to send you this so you can read through it. I know we're going through it quickly, but the nurse is considered an authority figure. We are, right? We need to be respecting all different cultures. We need to be able to relate to individuals in different cultures. And we'll talk about much more of this when we get to our culture part of the term. Okay, we need to respect dignity, respect values, beliefs, practices within cultures. Okay, so here's a little bit of you can read through this when I send it to you, but here's a nice summary of the Mexican culture and some of their cultural practices. Okay, so have a look at that. Okay, then the last question. So here's a man, Jose, who works in the grape fields for 12 to 13 hours per, I know you can see the answers, which is fine, but he works in the fields 12 to 13 hours a day. He's responsible for picking fruit and packing, moving crates to be picked up. Select all that apply. What are potential issues for him? Okay.
Improper body mechanics.
Okay, so that's C. Maybe eye problems related to chemicals because he's working on the fields 12 to 13 hours a day. D.
Which then chronic exposure to those chemicals can relate to
Exactly.
skin cancer.
Is that E? And that's what that rationale will explain. Okay. So I will send you this case study along with the recording, and you can read through it, but it just reinforces a little bit about the rural population, migrant population. Okay. So we covered rural, migrants, homelessness, and poverty. Okay, so I'm really hoping that between the lecture and the quiz and your readings, you have a better understanding of these populations. Do you think you do? I mean, you don't really think about rural populations, unless you live there or your family lives there and you go visit. You just don't think of the rural populations. I live in one, so it's pretty front and center, and it's everything I'm teaching you. Everything. It's very challenging. So, okay, I'm 6 minutes late because we didn't take a break. I apologize. I will send you the recording. I'll send you the case study, and we already talked about the exam. If anybody would like to stay on for questions that are individual questions, I'm happy to. But before we leave, does anybody have any overall questions that will benefit the whole group?
I do. So exam 1, so unit exam 1, that's strictly from weeks 1 to 3.
Yeah.
Okay.
Yep. Any other questions that will benefit the whole group? Well, I hope everybody has a nice weekend. It was good to see everybody today. And reach out next week if you need some help with preparing for the exam, okay?
Thank you.
Thank you.
Thank you. Have a good
We'll see you
weekend.
next week. Okay.
Yeah.
All right. Bye.